Breaking news right now, the State Department of Health says there are 2 presumptive positive cases in Broward County. They're giving a press conference right now. Why don't we go ahead and listen in?
Good morning. I am Dale Holness, the Mayor of Broward County. Please hold your question until the end of our press conference here. We're here just yesterday discussing the issue of coronavirus. And important changes have occurred since yesterday. That's how fluid the situation is. And I'd like to have Dr. Paula Tachi, head of the Department of Health in Broward County, go ahead and give some update, and then I'll come back and share some remarks.
Thank you, Mayor. Good morning. I'm Dr. Paula Tachi, Director of the Florida Department of Health in Broward County. 2 presumptive cases of COVID-19 have been reported in Broward County. The Florida Department of Health in Broward County is working closely with patients, potential close contacts of each case, and healthcare providers to isolate and monitor persons who may have been exposed to COVID-19 and implement testing of anyone who may develop COVID-19 symptoms, including fever, cough, and shortness of breath. I understand that this news is concerning, but this is what we have been getting ready for, and we will continue to work together to protect our community. Please remember that the symptoms of COVID-19 are fever, cough, and shortness of breath. COVID-19 can be spread from person to person by small droplets that are expelled from the mouth and nose when an infected person coughs or sneezes. These droplets can land on surfaces or objects, and other people can contract COVID-19 by close contact or by touching these objects or surfaces and then touching their eyes, nose, or mouth. The period between exposure and development of symptoms is 2 to 14 days. Currently, there is no vaccine or approved treatment for COVID-19. But the measures that we all need to take to protect ourselves and our families against respiratory illnesses, including COVID-19, remain the same. Wash hands frequently with soap and water. If soap and water are not available, use alcohol-based hand sanitizer with at least a 60% alcohol content. Avoid touching your eyes, nose, and mouth. Avoid close contact with people who are ill, and stay home when you are sick. Cough or sneeze into a tissue and throw it in a wastebasket. Clean and disinfect frequently touched objects and surfaces using regular household cleaning spray and wipes. Any person that experiences fever, cough, or shortness of breath within 14 days after travel from China, Italy, Iran, South Korea, or Japan, or any other destination that is designated under a CDC travel advisory should call ahead to their healthcare provider and also to the Florida Department of Health in Broward County at 954-412-7300 before visiting any healthcare facility. Additionally, if a person has had close contact with someone showing these symptoms who has traveled to these areas or has been in contact with a confirmed case of COVID-19, they should do the same. Their healthcare professional will work with the Florida Department of Health in Broward County to determine if that person should be tested for COVID-19. Working with our partners, the Florida Department of Health in Broward County continues to provide information to our community, monitor community health status on a moment-by-moment basis, provide expert consultation to the public and to healthcare providers 24/7, coordinate the collection of specimens for testing, and provide up-to-date guidance to our partners. The situation is rapidly evolving. Please see cdc.gov and floridahealth.gov for the most updated information. For any other questions related to COVID-19 in Florida, please contact the Florida Department of Health's dedicated COVID-19 call center by calling 1-866-779-6121 or emailing covid-19@flhealth.gov. The call center is available 24 hours a day, 7 days a week. Thank you.
Let us not panic. Let us not allow fear to take over our lives. What we ought to be doing is taking the precautions that are necessary, follow the advice of Dr. Tachi and other health providers. We cannot allow ourselves to be crippled by this. We must still continue to go about our daily lives, but use every bit of precaution that we can to ensure that if we are ill, we're not transferring it to anyone. And if someone is ill, we do not allow it to get to us, that we use those precautions, washing your hands on a regular basis, not touching your face, avoid someone who might have the symptoms of this disease. We're not at this time canceling anything. I trust our healthcare providers and the health experts to do what they need to do to ensure that the folks that needs to be isolated are isolated, and that they will take care of doing the treatment that's necessary to take care of these patients that are there. Again, the most important thing for us to do is to use precaution in everything that we do as we go forward. And it's been said time and time again, wash your hands, don't touch your face, stay away from folks who are showing symptoms. We are doing what we need to do, and we'll continue to do what we need to do in Broward County to ensure that we're taking the extra work to clean and sanitize where we need to, or airport, or seaport, or buses, or public-facing facilities, to ensure that we're doing what we have to do to protect the public. Now we depend on you to use every bit of caution to ensure that we all stay calm and avoid the consequence of this that could be dangerous if we are not cautious in what we do. Thank you. Joining me is Commissioner Yu Dean this morning, and if you have any questions, you may go ahead.
Mayor, can you tell us where these cases are in Broward County and what hospital or hospitals these patients are being treated at?
That's something that I'll defer to Dr. Tachi.
And so while we definitely understand the desire to know this information, the epidemiologic investigation is ongoing. We cannot discuss the details of individual cases. We must protect the confidentiality of individuals, and we must guard their protected health information the same way any of us would want our information guarded. The Department of Health is working closely with patients and potential contacts and taking the necessary actions.
Do you know if they traveled before, or kind of potentially how they might have caught?
So again, the epidemiologic investigation is ongoing.
And we're saying presumptive positive, but can we say confirmed cases, or are we still sticking with?
So presumptive cases are those that test positive at the Florida Department of Health Bureau of Public Health Laboratories. Cases are confirmed by the U.S. Centers for Disease Control and Prevention laboratories.
Has Broward changed any health care, the way you guys are handling based on the fact that these two new cases have presented?
The department continues to share the most updated information with all of our healthcare provider partners, and they continue to implement the latest CDC guidance.
Hospitals, though, are they going to start wearing masks and heightened awareness even more so now that it's actually here, presumptively here in Broward?
So each of our 16 acute care hospitals have received and are implementing the latest guidance from the CDC with regard to how to handle COVID-19.
I understand HIPAA rules sort of handcuff how much information you can release, but talking about whether people travel or whether people are hospitalized doesn't really violate individual healthcare privacy rights. Can you be a little more specific about whether these cases, the two in Broward specifically, are in a hospital or have come from China or traveled recently?
Again, the epidemiologic investigation is ongoing. We cannot discuss details of individual cases. What is very important for the public to know are the measures that I talked about and the measures that the mayor talked about. We all can take these simple actions to protect ourselves against COVID-19 and other respiratory diseases.
But that doesn't answer the question. You can say in general terms, people are in the hospital, or you can say that they're at home being, quarantined.
The appropriate actions are being taken with regard to the isolation of each case.
So they're at home?
The appropriate actions are being taken, and the appropriate infection control actions are being taken as per the guidance from the CDC.
Through the investigation, how that goes, how long it takes, more or less. Just because, I actually, sometimes rumors go around. I mean, before it came here, oh, there's a case here, there's a case there. And then, come to find out that in this case, what I heard about, 2 cases in Broward, presumptive cases, was true. So it begs the question, how long do officials know before they tell the public? Because obviously it does bring about a little concern, thinking, did I come into contact with this person? Could it be someone at, a teacher at my son's school? Obviously, all these questions. How long does it take, and is there a certain amount of time that it's kept from the public? Is there a limit to that? What's the process?
So again, there's a differentiation between the general public and between contacts that need to be traced and properly informed. And so we do that on a continuous basis. And so there is no specific amount of time. It would depend on the individual case, but our staff are working 24/7 with regard to these issues.
I guess my question is, at what point does it make it okay to tell us what hospital, what county, where, at what point?
So the latest information with regard to these issues is going to be found at floridahealth.gov. And again, we continue to provide the information to the public that they need to protect themselves, and to individual contacts, we contact them individually and take the appropriate actions with regard to those individuals.
And I guess this is new to a lot of us, the magnitude of what this is. What is the investigation like? Do you contact people they've come into contact with? Are they even, are they able to speak? I know in one of the cases we read that he wasn't altogether there to tell what, give us some examples, I guess, so we understand.
Again, we employ professional epidemiologists at the Florida Department of Health in Broward County. They follow guidance from the Florida Department of Health and from the CDC, and they conduct epidemiologic investigations to the utmost of professional standards. Again, I cannot discuss details of individual cases.
What's the time frame from when these cases came to you came to know of these cases and when they were deemed presumptive positive?
So the time frame that you're speaking to would be the time frame would really be the time frame between when the cases were tested and when the results were provided by the laboratory. And that is, and that time frame is a pretty standard time frame with regard to that. The public was informed immediately as soon as those presumptive positive results were returned.
So it showed up on the radar to where you said, yep, this is an issue.
I'm not sure I understand your question.
Does it take how long does it take to get those results back? Like 2 to 5 days, or is there a time frame?
The current time frame with regard to testing at the Florida Department of Health laboratories, we would have to get back to you with that. That would depend on the number of specimens that are received.
Okay, so if they get like 100 test kits back, it'll take longer to get each result back.
Again, I can't specifically speak to capacity. That's an issue for the Florida Department of Health, and you can go to floridahealth.gov.
And these two presumptive positive cases, from what I understand, when they test positive and the CDC comes behind them to confirm it, has the CDC confirmed these two cases?
They are presumptive.
Confirmed?
It means that they're presumptive. It means that they are not yet confirmed by the CDC.
Mayor, talk to us. So obviously, we've seen a lot of cancellations happening down in Miami-Dade. At what point are you guys going to meet and try to discuss public events? Obviously, we've seen a lot of action happening further south in Dade County in terms of Ultra, Calle Ocho, stuff like that.
We have a county commission meeting on Tuesday, and I'm certain that there'll be some conversation around that.
Is there any concern that the appearance of the lack of specific information might feed whatever apprehensions and panic might grow from it?
We are providing the public with specific and updated information with regard to what we all need to do to protect ourselves, and those remain the same.
Yeah, there were 88 cases statewide, I believe. Are there more now?
For state information, you need to visit floridahealth.gov, and that website will provide you with the most updated information available.
And the two cases, presumptive cases in Broward, are still a 65-year-old and a 75-year-old, or is that statewide? There were two cases, and they talked about two people who had that was two people who had died, I believe. One in elsewhere in the state, not here, but
Again, I can't speak to cases elsewhere in the state.
Just inside of Broward.
Can we ask you? Other counties have shared a little bit more information in terms of patients and their presumptive cases. Is there a reason why we're limited information is coming from you guys?
We're providing the information that the public needs to know, and that is provided by the Florida Department of Health.
Okay.
How often are we going to have updates like this?
As the need arises. If there are new cases or if there are new issues that we have to deal with, we will be out in front of it, letting you know, bringing you together so the public can be informed as to what is going on. Again, let me thank you for being here. The key ingredient here that we must learn is to be cautious. Take the precautions that's necessary. If you're sick, stay home. Wash your hands frequently, at least for 20 seconds, using soap. And if soap's not available, use sanitizer. Cough or sneeze into your elbows. Avoid touching your eyes, ears, nose, your face in general. Avoid close contact with anyone who is showing symptoms of respiratory conditions. And if you travel abroad to one of these areas that Dr. Tachi spoke about, be sure to pass that information on. Don't just come in without letting the health department knows that you've traveled. And we're doing what we can at the airport also to screen these folks that are coming in, to isolate them if necessary from whatever country that there's an issue. Again, I thank you for being here this morning.
Sorry, just one other question. What kinds of calls are you getting from people who want to know? And they're getting certain answers from the media, but maybe you get a phone call saying, I was coughing last night. Have I got it? I mean, what kinds of calls are you getting, if any?
So I don't know how many calls that we've gotten this morning, because obviously I've been here. We have nurses and other healthcare professionals that are taking those calls and evaluating them on a case-by-case basis.
I don't know if you've mentioned this already, but are there possibly other cases in Florida being investigated now? I'm sorry, not in Florida, Broward County.
And so we very much appreciate the desire of people to know about how many people are being tested or how many people may have tested negative. But again, it is very important to protect the personal protected health information of individuals. And so we're not discussing on a county-by-county basis the number of tests that have been done or that have been negative or that have been pending.
And then the last question
That is available on an aggregate basis at floridahealth.gov.
Right, but not county by county. Got it. And then my last question is, there's healthcare professionals, there's teachers, people who do come in contact with a lot of groups of people by virtue of what they do. Can you tell, how do you tell them they can't leave the country? What happens? Are they going to be under quarantine if they do? Spring break is coming. Teachers may be wanting to go out of the country. How is that going to work?
So there is very specific guidance for educational institutions that the CDC provides and that we have provided to our educational institutions. And based upon that latest guidance, they develop their own policies and procedures.
Mayor, any plans to meet with the superintendent over the weekend to discuss schools? Any changes coming up with that, or is the next time everyone's going to meet going to be maybe y'all's commission meeting? Or
There's ongoing discussion, and the superintendent and the school board is being kept up to date and informed. They will decide their protocol and what they do on their side. The county commission won't dictate to them what they do. Thank you.
All right, press conference with Broward County officials just wrapping up there in Plantation about the coronavirus. So here's a recap. We do have 2 presumptive positive cases, but as you heard there from Dr. Politachi, they won't be confirmed until the CDC confirms them. As for what's next, no more details as far as where those people are being held, a hospital, but they are being isolated. The mayor did say there that as right now, no events have been canceled in Broward County. They will have a commission meeting on Tuesday where that will be discussed. And towards the end of that press conference, they were asked about the school. School boards will make those decisions independently. That'll do it for